The more sand has escaped from the hourglass of our life, the clearer we should see through it. The aim of the ERTC 22922/10925 trial was to determine the impact of internal mammary and medial supraclavicular lymph node irradiation in stage 1 to 3 breast cancer patients. This trial specifically included patients with axillary node involvement or centrally located tumors. From 1996 to 2004, 4,004 individuals were randomized into the study. Participants received either internal mammary and supraclavicular lymph node irradiation, IMMSRT, or no extra irradiation, with a primary focus on overall survival. Key secondary outcomes included disease-free survival, distant metastasis-free survival, breast cancer mortality, and recurrence, measured over a median follow-up of 22.2 years. Quick take. This large trial pitted a form of targeted lymph node irradiation against conventional treatment to see which had a survival edge over 2 decades. Results indicated that at 20 years, overall survival rates were nearly identical between control, 61.8%, and IMMSRT groups, 61.0%, with a hazard ratio of 1.00. The breast cancer mortality rate was notably lower in the IMMSRT group at 18.6% compared to 22.4%, showing significant mortality reduction, p-value equals 0.006. However, other mortality causes increased with IMMSRT, negating long-term overall survival advantage. Safety concerns were evident, with higher incidences of lung and cardiac complications from IMMSRT. The authors conclude that while IMMSRT reduced breast cancer mortality, the rise in other causes of death highlights the need for long-term monitoring in favorable prognosis cancers. Quick take. Despite reducing breast cancer deaths, this study raises concerns about other health risks associated with the treatment. Short quiz, clinical vignette. A 54-year-old female with stage 3 breast cancer and axillary node involvement is considering treatment options. She had a normal cardiac evaluation at baseline. Based on the ERTC trial findings, what is the most appropriate counseling point regarding the long-term effects of internal mammary and supraclavicular lymph node irradiation? Option 1. It reduces the risk of all-cause mortality over 20 years. Option 2. It significantly decreases breast cancer-specific mortality over 20 years. Option 3. It prevents cardiac events more effectively than no irradiation. Option 4. It increases the overall survival significantly compared to no irradiation. The answer is option 2. Choice 2 is correct. The ERTC trial results showed a significant reduction in breast cancer-specific mortality with IMMSRT, although it did not reduce all-cause mortality due to an increase in non-breast cancer deaths, particularly from cardiac events.